Welcome back to Lunch Break. I'm Simon Constable. How did the Affordable Care Act really come together? We have an insider's look at how it all went down inside the White House. Dr. Ezekiel Emanuel served as the White House Special Advisor on Health Policy and was part of the internal debates that shaped the law. He joins us now to reflect on that time and explain why it was so difficult to put the law together. Dr. Emanuel, thanks for joining us.
My pleasure. It's wonderful to be here.
So one of the issues you struggled together with was bundling payments, and your idea there was that bundling payments might be economically good policy for healthcare. Why would you say that that was good healthcare policy, and what went wrong?
Most of us who are in health policy think it's important to shift away from fee-for-service to provide incentives to doctors and hospitals to treat patients to keep them healthy instead of just treating them when they get sick. And one mechanism of changing the payment system is bundled payments, where you basically take an episode of care and you put all the pieces together and you give doctors and hospitals one price, encouraging them to be efficient, to prevent the patients from getting sick and getting complications. We tried to do this and to try to have a timeline to introduce more and more bundled payments. Unfortunately, we ran into the bureaucracy, which was a little resistant to this. They like business as usual. They didn't have the computer systems to put in place, and they were really resistant to the idea of the timeline.
And that's Medicare, is what you're talking about there. That was part of the existing infrastructure. Now, another example was the tax exclusion, which is now over half a century old. Your healthcare costs are pre-tax. That was where good policy overcame what was good politics.
Right. One, good politics is don't touch it, because the Republicans have repeatedly tried to touch it, and every time they tried to do it, they get slammed for it, in part because people like this tax break. It is worth $250 billion. On the other hand, the president was convinced that the better policy was to limit it. That would be a very effective way, actually, of controlling healthcare inflation. Despite being against it on the campaign trail, he was persuaded that this was the better policy. And despite a lot of political opposition from people like the unions, he voted or allowed the Cadillac tax to be put in as part of the Affordable Care Act. I think that demonstrates that with leadership you can actually get policy even when the politics aren't there.
Now, this law was massively ambitious. I mean, it's basically, it seems like a wholesale change in the way that healthcare insurance is certainly provided, and some of the intricacies within that. Was it too much? Was it too big a bite to take? Would it have been better to try and tweak at the outsides? What do you think?
Well, lots of people have said incremental reform would have been better. I think, again, politically it would have been better. From a policy standpoint, I don't think you could have done incremental reform and had as much impact on the system. So I think that was, from a policy standpoint, far and away the better option.
So we've witnessed the rollout of the website, the healthcare.gov website. That didn't go at all smoothly. That must have been a disappointment. Do you think that this rollout has recovered from that black eye?
Well, I don't know that it's fully recovered, but it's certainly the federal website is working well. There are many state websites like Connecticut, Kentucky, California that are really working well. And I think over time they're really going to be much better places to get health insurance. And I think people are going to find out that they're pretty efficient, they're customer friendly. But they need constant attention and constant work to make sure they're at the cutting edge of technology, at the cutting edge of consumer experience. And I think that's going to be the issue going forward. It certainly wasn't a good execution or implementation out of the box.
Okay. Thank you very much. We have to leave it there. Dr. Ezekiel Emanuel, we appreciate your time, sir.